What's going on, everyone? Happy Saturday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Saturday edition of the Pandemic Update for Saturday, June 15th, 2024. If you're new to my channel, this is where we do the daily pandemic update on not only just COVID, but all these other viruses that could be a health threat to you. Let's face it, there are a lot of viruses out there, and each of them could be a health threat to you. You don't hear much about these viruses in the news, despite the fact that we seem to learn something new about them every day. You may see here a headline. The first thing we're going to talk about today is H5N1 bird flu. That keeps evolving each day, but you hardly ever hear about that or the other viruses in the news. You need a place where you can turn to be informed of what's going on with each of these viruses, and that's what I do for you each and every day. So if you're new to the channel, subscribe down below, give it a thumbs up, share these videos with anyone you know, leave your comments down below, and hit that notification bell. You'll be notified when we do the daily pandemic update. Alright, we do have several things that we're going to talk about in the news category. Several of them will be from Twitter, and then we're going to take a look at some daily data. We're also going to take a look at some more of those emergency department visits for COVID. We'll take a look at levels in some more states and a few other states' data. All right, starting off today, H5N1 bird flu found at 7 more dairy farms, including 5 in Colorado and 2 in Iowa. I'm seeing a lot of people posting about H5N1 lately, and a lot of people speculating, will it become a pandemic? Will it not become a pandemic? Here's the way I'm looking at it as of right now. It is concerning that we are seeing H5N1 spread. It's concerning that BNO had to tweet this out 9:30 on a Saturday. Now, maybe this news came out yesterday and they just got to it, but maybe it didn't, and maybe it did come out today. If it did come out today, that's concerning. In the early days of the COVID pandemic, we often did not get many updates on the weekends. The weekends were pretty much like, oh, well, we're not going to tell you anything about it till Monday. Hello. Viruses don't just magically disappear on the weekend. Viruses continue to spread 24/7, 365 days of the year. So, my concern level for H5N1, it still is in moderate levels right now. Am I going to go out and say that it's going to become a pandemic? Sure. It could one day become a pandemic. Right now, we just have to watch it day by day and see what happens with it. All right, moving on to New Zealand now. Patients waiting in emergency department for hospital beds as respiratory cases rise. Time and time again, we see this happen. Was it an issue in many countries before COVID? Yes. But now it's even worse now that you're adding on a new level of strain to the hospitals because of the COVID pandemic. It says at Nelson Hospital, 17 patients with COVID-19 are currently in isolation, and 7 patients are waiting in the emergency department just to receive a hospital bed. So there you have it. In New Zealand, there are people just waiting even to be seen, even to be admitted to the hospital in the emergency department because there currently isn't any beds available, and we have seen this happen in many places throughout the pandemic around the world. Moving on now to some vaccine news. Novavax has submitted its application to the U.S. Food and Drug Administration for its updated COVID vaccine, and that is going to target JN.1, but it's sounding like it's also going to provide some protection against KP.2 and the KP.3 variants. Mind you, right now, it is June 15th. This is the fall vaccine. Obviously, you'd be able to get this in the fall. Who knows what variant we're going to be on at that point. And I do have some more vaccine news. The FDA is updating its advice to manufacturers of COVID-19 vaccines 2024-2025 formula. The agency has determined that the preferred JN.1 lineage for COVID-19 vaccines is the KP.2 strain if feasible. Remember, we have a lot of states now that are starting to see rises for COVID, and things are rapidly evolving, so they're taking it to the next step and going with the KP.2 variant at this time. It says the change is based on the most current available data along with the recent rise in cases of COVID-19 in areas of the country and is intended to ensure that COVID-19 vaccines are more closely matching circulating SARS-CoV-2 strains. Remember, I mean, again, we're in June right now. Variants constantly keep changing. Who knows what variant will be on during the fall period. And it says FDA does not anticipate that a change to KP.2 will delay the availability of vaccines for the United States. All right, moving on to this now. Wastewater Scan did do some weekly data, so I want to read you their thread. COVID-19 nationally in the South and Northeast. SARS-CoV-2 is in the high category with medium concentrations and an upward trend over the last 3 weeks. The West and the Midwest are currently in the medium category. As for influenza, nationally and in all regions, flu A and B remain in the low category and not in onset. The national average measurements are approaching 0, so that's some really good news. H5, bird flu. H5 influenza over the last 4 weeks. H5 has been detected in 6 states, in Texas, Michigan, Idaho, Iowa, Minnesota, and California A as of 6-13. Texas, Michigan, Idaho, Iowa, Minnesota have also had infected cattle herds reported. All right, moving on to this. HMPV is now in the low category nationwide. HMPV was detected in 50% or less of samples tested over the last 2 weeks, considered no longer in onset. Moving on to number 5, norovirus is in the high category nationally, but with a downward trend over the last 3 weeks. The Midwest and Northeast are both in the medium category. Alrighty, I thought I would share this little tidbit here from Scott Squires on X. COVID is not a cold, nor is it mild. It is a vascular disease affecting every organ. It is preventable with a respirator mask. Yes, N95 or better masks do work. Why? Because there are several studies that now suggest and say that, hey, it prevents the majority of cases of COVID. And why do you need to continue wearing a mask? Do I need to remind you about long COVID? I will. Long COVID can affect the brain. Long COVID can impact your heart, your lungs. It can impact your ability to walk. It can impact your day-to-day activities. COVID is a vascular disease, once again, affecting every organ of your body. Alrighty, moving on now. Taking a look at what is going on with the pollen levels. Drumroll please, 51% of the country is in medium status. You can see there's still some oranges, but there's way more yellow today than there is oranges, and no red on the map today. Taking a look today at the latest air quality data, and we will see across the United States, things have gotten better in the Northeast. It's actually not a bad day for air quality in the Northeast because that front has come through. And if you're in the South, the usual hot spots do continue. Take a look at this. Across Arkansas, Alabama, Georgia, Louisiana, Mississippi, Texas, Oklahoma, even across portions of Kansas. And unfortunately, that air is going to lift northward and head for the Northeast next week when a major heat wave comes. More on that in just a second. Taking a look out here in California, you can see California, it's continuing to have its usual hot spots in the Southwest. Pacific Northwest is not doing bad. Heat-related illnesses, they are going to continue to increase across the United States. There is going to be a week-long heat wave that impacts the Northeast and East Coast in a big way. This map's not coming up. Trust me, the heat-related illnesses, they are starting to go up. We can refresh this. And yes, please take it easy if you're in the heat. Drink plenty of liquids. And just don't overexhaust yourself outside. Limit your time outside. Spend more time in the air conditioning. The map finally came up. You can see in the Northeast, it already was increasing, and it's going to increase even more. I have 2 more places that I talk about climate and weather. One is Climate Data Report on X, and the other is my YouTube channel, where I do talk about weather day after day. And you can see here, it is at Climate Data Report. We did just release a video just a little bit ago about the major heat ridge that is going to set into the eastern United States. All right, taking a look at Philadelphia. EMS totals yesterday, 811 EMS incidents. And I can tell you one thing, things are not back to normal in Philadelphia. Things are not fine in Philadelphia. I want to show you something today that caught my eye this morning. This is totally ridiculous. In fact, we're going to refresh this because it updates all day long. This is SEPTA. SEPTA stands for Southeastern Pennsylvania Transportation Authority. They have the authority over transportation, mass transit. You take the train, you take the bus, take a trolley, which we have all those services here. We have subways. And I want to show you this. All day long, this has been going on. Route 4, Route 16. Due to operator unavailability, scheduled trips are subject to delays. Route 61, 62, operator unavailable, on and on it goes. I could go on and on here. They clearly are understaffed right now. Maybe they have people that are calling out sick. Maybe they have people who have had to retire early because of long COVID. Also, safety concerns as well. I mean, let's face it, there is a violence issue going on in my city. But the key takeaway here is, since the start of the pandemic, this has been a real problem, and it has not gotten better. So no, things are not back to normal. Now, mind you, it's a Saturday, but I've been witnessing this happen. I've been seeing them tweet about this on weekdays. It's been impacting people trying to get to and from work. And meanwhile, our city and many other cities are trying to push for people to get back into the office. Good luck with that when you have mass transit that is very unreliable. Just a total joke, if you ask me. All right, take a look at this. Wow, 18 calls right now in Montgomery County, Pennsylvania. I'm seeing respiratory calls. I'm seeing nauseous calls, head injuries, sycopal episodes, heart problems. We're seeing all kinds of different issues showing up here, and we're also seeing that popping up with Chester County as well. We do see multiple sick person calls, respiratory difficulty, unresponsive person, EMS standby. So yes, it's a busy day for the EMS personnel. All right, taking a look now at Walgreens for this week. And Walgreens positivity rate for this week is 27.1%. The prior week was 22.9%. Difference of up 4.2%. Total tests 4,213 versus 3,512. Would I like to see that number higher? You better believe I would like to see that number higher, but it did go up a little bit for testing. The number I don't want to see higher is the positivity rate going up, and I have a feeling that's going to continue to inch its way upward yet again next week. All right, taking a look at wastewater. We just want to take a look at the national wastewater. Let me refresh this. Tomorrow is wastewater day. We'll take a look at a whole bunch of sites tomorrow, but I do want to bring this to your attention. 80 to 100% COVID detected. That's these sites in the red. There are 27 of them. You can see there are some in Florida. There's actually multiple ones in Florida. There's one in New York City area. There's a few in California, and Hawaii is pretty much lined up with them. There's quite a few of them in Hawaii, and you do see there is even one up in Alaska, although that site is starting to level off and drop now after a big rise. So not good to see that. And then when we take a look at the averages from each state, it does show there are places that are still very high. Montana, Hawaii is very high. Florida is now very high. High status now in Connecticut. California is high. Alaska is high. So there are places that are starting to go high or very high. There's moderate in Wyoming. There's moderate in Nevada. You get the idea here. Some states are starting to see an increase, while other states, like Kentucky, it's still minimal. It's still low in Colorado, minimal in Kansas. So not everywhere is rising at once, which is why the national average is just gradually going up. It's not going straight upward like it is in Hawaii right now. We've been showing you that. All right, taking a look now at the hospital situation, and we can see here emergency department visits. This is the percent increase, and we can see there's been quite the increase in several states right now. Substantial increases in West Virginia, in Virginia itself, Illinois, Indiana, Iowa, Nebraska. And Texas is seeing a moderate increase at this time. Substantial increases now, even up in the great state of Vermont. Now, who remembers when at the start of the pandemic, Vermont was one of the best states? Well, right now, they are currently seeing substantial increases on a percentage basis for emergency department visits. Nationally, you can see here emergency department visits. They are trending upward. Let's take a look at just a couple states at this time. We're not going to go too crazy here. And we can see Michigan. not following the national average. So if you live in Michigan right now, the national average is upward, but local to you, you are not seeing a rise at this point. But again, even though you're not rising yet, continue to mask up. Taking a look now at what is going on. Can we look at North Carolina? Some of these states do not rise. If you are in North Carolina right now, don't pay attention to what happened in Michigan because you are seeing an ever so slight rise. Mask up. If you live in, let's go out to the West Coast, shall we? I don't know if we can look at Oregon. Let's see. Some of these states just spin around in circles. Here we go. If you live in Oregon, you're going up a little bit faster than the national average. And within the past few days, you're starting to almost go vertical. Look at that. You can see these blue bars. They're really starting to push upward. Guess what you need to do in Oregon? Mask up. You need to mask up in all states when you go into grocery stores or to crowded places. Why? Because it is the right thing to do. Remember, we showed you here, COVID is a vascular disease affecting every organ. So you need to help prevent yourself from getting long COVID. Yes, some people do not get long COVID. Some people do not have any symptoms. It's very random as to who that is going to be. Other people could be perfectly healthy going into COVID, have no issues, no underlying conditions, and suddenly they find themselves in the hospital. That's what happens with this virus. It just randomly chooses people to impact more severe. There's many different reasons. It could be your viral load. There are just many different reasons. If the situation is correct, a lot of times COVID is like weather. If the conditions are favorable, severe thunderstorms will form. If conditions are favorable, you will catch a case of COVID. All right, moving on to New Jersey. In New Jersey, and I do have to refresh this, and I don't think all the hospitals updated. Let's see. How many did we have today? Pretty sure it's 60. Okay, it is. It's 68 out of 70. But mind you, we are on a Saturday here, and on a Saturday we are seeing an increase in hospitalizations. 184 hospitalizations. Again, 68 out of 70 hospitals reported. On a ventilator is 7. In the ICU, 20. Discharges at this time is at 25. But again, hospitalizations are at 184. We've been hovering over in New Jersey. They've been hovering between the 160s and near 200. We haven't seen any big push above 200 yet, which is a good thing. If we start seeing it becoming consistent where it gets over 200, then it starts getting a little bit more concerning. Just to remind you that New York State yesterday, we may not even be able to see this. Here it goes. New York State yesterday had 1,090 cases, and their hospital situation at this time, their hospitalizations did rise ever so slightly yesterday. They had 585 people in the hospital. Number of people in the ICU slightly dropped to 60. Taking a look at LA this week. LA hospitalizations for COVID did rise ever so slightly. Cases dropped ever so slightly, but the positivity rate continued to rise and did go over 4% this week. California as a whole this week, it does not look like let's see here. Are we going to get it? Okay, we did get it. And it does look like COVID deaths went up ever so slightly. The positivity rate this week is 6.4%. That is up by 1.8%. And influenza deaths went up ever so slightly. And the influenza positivity rate did also go up ever so slightly this week. Going back just for a second, there was something that I forgot to show you, and that was the epidemic status for COVID. I did want to get this in here today. Many states are in the growing phase. If you live in Florida, if you live in Alabama, if you live in Mississippi, Texas, Arizona, if you live in California, Oregon, Washington, South Dakota, Indiana, Maryland, Massachusetts, you're all in the growing phase for epidemic status. In other words, meaning COVID is definitely increasing in your area. And then there are a lot of states, I'm not going to list them all, that are likely growing. You can see them here. New York State, you know what, let's do it. New York State, Pennsylvania, New Jersey, West Virginia, Kentucky, Ohio, Illinois, Michigan, Wisconsin, Iowa, Minnesota, Montana, Wyoming, Utah, Colorado, Alaska, Hawaii, Arkansas, Louisiana, Georgia, and North Carolina. And if I forgot any, I apologize. All those states right now are likely growing for COVID. Then you have several that are stable or uncertain. You only have one that's likely declining. That's New Hampshire, and none are declining at this point. And of course, it is not estimated right now in Missouri. Alrighty, folks, that does it for the Saturday edition of the Pandemic Update. If you enjoyed this update, give it a thumbs up. Do you want to be informed? Do you see what we do here now? Subscribe down below, and you'll get something like this almost every day. We try for every day. And of course, hit that notification bell, share these videos with anyone you know, and leave your comments down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Saturday afternoon. Thanks for watching.